a viewpoint piece that I was encouraged to write by the patient whose story I share. It talks about the importance of remaining vigilant for opioid use disorder, which is commonly referred to as an opioid addiction. The particular patient in this story wanted to have their personal experience with opioids shared with the broader medical community in order to highlight the important role that clinicians can play in identifying this condition and referring patients for appropriate treatment, which for many can truly be life-saving. Hi, I'm Nafisseh Warner, and I'm an anesthesiologist and pain physician at the Mayo Clinic in Rochester, Minnesota. This story is featured in the April 2020 issue of Mayo Clinic Proceedings and is entitled, "A Surgeon Saved My Life, A Story of Addiction." This patient was a very high-functioning medical professional who unfortunately had developed chronic pain early in adulthood after traumatic injury. They were treated with escalating doses of prescription opioids and ultimately wound up addicted to these same medications. They would search for loose opioid pills from wherever he could find them. At work, at home, in the car, at friends' homes. After years of seeking care with a variety of medical providers and feeling that they had transformed into a completely different person, the patient was ultimately referred to a spine surgeon to evaluate ongoing lower back pain pathology. This doctor-patient interaction was quite distinct from those that had come before. So the surgeon didn't just ask about his back symptoms. He sat down with the patient and asked about his history of pain. He asked about his history of opioid use, and he asked about his ongoing struggles with identity. Most importantly, the surgeon listened from a place of non-judgment. The surgeon was the first to discuss opioid addiction with the patient. It was the first time that any medical professional had told him that he may be addicted to opioids. Most importantly, this particular surgeon had emphasized the importance of getting help. The patient was subsequently referred to an addiction specialist and received medication-assisted treatment for opioid use disorder. Over the next few months, he was able to gain control of his addiction and regain his former quality of life. What can we learn from this patient's story? Well, first, recognition is the essential first step in treating opioid use disorder. We all must have the tools to recognize the condition and refer for help. Second, we need to remove the stigma associated with addiction and recognize that it can happen to anybody. Third, we need to take the time to sit with our patients, listen, and establish meaningful relationships. Every medical provider should know how to refer patients to appropriate addiction treatment resources. It is a remarkable opportunity to save a life. I hope you enjoyed this article, and I appreciate the time you have spent listening today. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.